Welcome to Valley Regional Hospital. I'm Elizabeth D'Orazio, and I'm joined by one of the unique specialists here at Valley Regional, Dr. James Wilton, and he is a peripheral nerve specialist and a podiatrist. And what you may not know is there's not many people with his specialty, and the great thing about Valley Regional is they have one of the few centers in New England that actually deal with peripheral nerve and chronic pain. So Dr. Wilton, thank you for joining us. I know you're very busy.
Thank you for having me.
And your specialty really is unique. Tell us about it.
It is. I had formal training as a foot and ankle surgeon, and then about 20 years into my career went down to Baltimore and took additional training through one of the plastic surgeons at Johns Hopkins for peripheral nerve injuries. And over the past about 15 years, that's been the focus of my practice, is dealing with lower leg, ankle and foot, chronic pain, and nerve injuries.
And a lot of people don't realize that sometimes when things happen, it can lead to constant pain, and that may be a permanent state or it may be something transitional. Is that correct?
It really can, and it's really individualized to the patient. As I tell our patients, if you have an injury that is severe enough to stretch a ligament, tear a ligament, break a bone, you more than have enough kinetic injury to damage a nerve. So the nerves are the most ill-protected of all the structures in the legs that we see, in ankles and feet, and they are very subject to stretch injuries and tears.
I think that's funny because it's the one system we never think about. Everyone thinks, okay, cholesterol, I've got it, and then I've got to watch my weight, and I've got to, I've got to keep my bones healthy, but we don't think the nerves.
Right, that's correct.
And the center that you have here, you mentioned in our discussions earlier that there is also a specialist for hands here.
Dr. Robert Bassett's a hand fellowship trained orthopedic surgeon, and he deals with the upper extremity arms, hands and wrists, and I deal with the lower legs, ankles, and feet. So it's a unique combination from an orthopedic background and then from a podiatric background to look at the two different extremities. And we're the first center that I know of east of the Mississippi that has an orthopedic surgeon and a podiatric surgeon that are addressing peripheral nerve issues.
One of the things that Valley Regional has done recently is the urgent care facility, and they've really tried to bring in another level of care with that. And having someone like you on board here is wonderful because, let's face it, hands and feet, they get injured a lot.
It is. The urgent care is a great center for the really less than acute traumatic injuries that would normally be seen in an emergency department. But a lot of the people that have chronic ongoing issues of pain, those are the patients that we'll pick up that they could refer over to our center for further care and evaluation.
And one of the interesting things is this is your home base. This is your hospital. This is your center. It
is. I was recruited to come here by Peter Wright, our CEO, in 2014, and I came from an orthopedic practice in Portland, Maine, and it's been a very nice year. As I tell my friends, I'm still in the honeymoon phase. So.
That's a good thing. That's a good thing. But one of the things I've tried to mention to people is finding a great hospital that's your home base with doctors you can get to know is really a wonderful partner in your life.
It is. I've had the opportunity in my career to work at large hospitals of several hundred beds, medium-sized community hospitals, and then critical access hospitals of 25 bed size like this. And I can say that it's very refreshing to work in a hospital system where you can go directly to the CEO if you have concerns. The staff here is wonderful. They're the most professional staff that I've had the pleasure of working with in my career. But the size of the hospital makes it unique, especially for the services that we offer. Especially in the operating room setting with the OR staff, we have the ability to efficiently see a lot of patients in a very professional manner without the backlogs that we would have at the larger hospitals and the delays in getting people to surgery. We can evaluate people and get them through their care system in a very straightforward model in a hospital this size.
Well, I want to thank you for joining us. I know you're very busy.
Thank you very much for having us.
And I want to encourage any of you who live in the area to look at Valley Regional as your hospital. And also remember, they have wonderful specialists like Dr. Wilton who do peripheral nerve and podiatry specialists.